Today on Real COVID Stories, I'm talking with Dr. K from Tampa, Florida. He shares with us the difference in treatment options available to those people he's seeing in ER versus those he's able to treat in his integrative medical clinic. He also discusses the type of scan that is being used to show damage in the lungs of even asymptomatic patients. You're listening to Real COVID Stories with Ivy Lane. The media numbers don't show the full story. Millions of people around the world have been sick for months and months on end. This podcast serves to share their stories, real stories of how people's lives have changed, stories of the daily struggles, the prejudice, the pain, the triumph, the funny, and more. So hi, it's Ivy here, and today on COVID Stories, we're talking to Dr. K or Prudhvi from Florida. Hi, Prudhvi.
Hi, Ivy. Thanks for this opportunity to get on your show. I'm really excited to share some of my knowledge and also to maybe find out more about you.
Lovely, and thanks for your time. It's great. You're the first practitioner I've had that I've been talking to, so there's a few more that'll hopefully follow. But yeah, thank you very much for your time.
No problem.
Can you just tell us a little bit about your background and your training and why you got into healthcare and medicine?
Sure. I was born and brought up in southern India, and my father was a general practitioner, so he had his own clinic. He used to see clients in the office, and in my childhood, I saw how he helped a lot of people recover from their illness, and I thought it was really cool, and I wanted to do such a thing one day, and that's why I started my career in medicine.
So did you study in India?
So I studied, I went to medical school in India, and then I came to the States in 2004. I did a master's in public health, and then I did a residency program in Illinois in internal medicine. And then I did 2 other fellowships. One was in sleep medicine and geriatrics.
Okay.
And I've been doing a lot of internal medicine stuff and some ER work in the last 10 years or so. I lived in Kansas, and now I'm presently living in Tampa, Florida. So I also have a alternative medicine clinic here in Florida. It's called Integrative Therapeutics. So I've been staying busy with my work and these ventures for the last several years.
Yeah, sounds good. So the integrative practice, is that where you're seeing COVID patients, or is it more in the ER sort of?
I see most of the COVID patients in the hospital setting, in the wards and the floors. There's not much in the clinic. Sometimes I would see some clients remotely because they prefer not to come in.
Yeah.
And sometimes we do testing. Sometimes we do IV vitamin infusions. So mostly in the hospital arena.
Yeah. And so you're able to do IV vitamins in the hospital?
No, not really. It's available, but what I can do is restricted here because of liability, and it's the same in Australia probably.
Yeah.
So I haven't done any vitamin infusions in the hospital setting.
Just in the clinic.
In the clinic, yeah.
Okay. And so have you personally had COVID?
No, I never. That's a good question. I never had COVID, or at least as far as I know. I may have had episodes where I had fever and so forth, but I was never positive for COVID. Through my work, I was tested for antibody, like the IgG antibody, and those came back negative.
Okay.
So yeah,
you've got through it so far. Fingers crossed.
Yeah.
So what, if any, are the trends that you're seeing in COVID patients?
Here in Florida and US in general, we were thinking that the numbers are going to be really high in March and April when the COVID first came in New York City, but we didn't have many cases at the time. We started seeing cases like at a really high level like 2 months ago, and since then, it is coming down, but it's staying like it is plateauing. So there are still a lot of patients coming in. It's not as much as 2 months ago.
Well, that's good.
But there is a steady volume of patients who are coming in. We're also seeing a lot of exposure, like if the kid goes to a swimming pool or if the kid is in a competition, they get the virus, and then obviously they don't pass it on to the parents, grandparents. So we are seeing the asymptomatic transmission a lot.
Yeah.
We had like a few deaths initially back in April, May, when the COVID first came. Lately, the number of deaths have gone down, and we are seeing like the patients stay for like many days to weeks in the hospital, but most of them are recovering and they're going home.
Okay.
Obviously, I don't know what happens after they go home. We don't follow them. So
yeah. Apparently, there was a study done in Massachusetts or Michigan. Now I don't remember, on follow-up.
Okay.
I don't remember the name of it.
That's okay.
But yeah, they were actually calling people 10 weeks later and seeing
10 weeks later
and seeing if they're still sick. And I think it was about 26% of people are still sick.
They're still symptomatic. Okay.
Yeah. Yes. Yeah. So
I've talked to some of the pulmonary doctors, and they noticed like even if you don't have any symptoms, if you're COVID positive, they noticed when they do the CAT scans. Obviously we're not supposed to do X-rays and CAT scans if there are no symptoms. But when they do the high resolution CAT scan, they notice a lot of fibrosis. There's a lot of damage in the lungs, even though they don't have symptoms.
That's fascinating.
And they're really worried, because that means the people who have symptoms may have more damage in the lungs that they don't know about. And some of them, they're starting them on medications like they're typically used for pulmonary fibrosis, which is fibrosis essentially like once you have the inflammation, you have the swelling. After the swelling, the body repairs the tissue, and then it becomes like a very thick tissue. It loses elasticity. It becomes, we call it fibrosis.
Yeah.
The problem is if it happens in the lung can't expand and contract like a regular lung can. So it affects the breathing function, the gas exchange, and the oxygenation. So they are starting them on some immunosuppressive medications that they typically use for fibrosis. So that's a very interesting trend we noticed when I talked to them. But again, we are looking for studies. Like we don't have research to find out like what the actual numbers are, like how many people have that problem versus how many people have COVID and they're completely recovering and their lungs are completely fine. We don't know that yet.
I would love to get mine scanned. The lung for me wasn't such a big issue. Because when it started to go to my lungs, that's when I contacted a Chinese doctor who made herbs for me, and I was doing what I could. And I did get some lung stuff, but that's not a symptom that keeps coming back for me.
So you don't have any shortness of breath or difficulty with breathing?
I mean, I did, but I don't. I did for maybe a week and a half, 2 weeks, but it wasn't significant. But my lungs are the strongest part of me.
That's good.
So, but that was when I got really scared, because I'm like, I've never had anything in my lungs, and now I've got something. That's when I was like, okay, this is beyond what I can do, and that's when I, really started to get help, because I couldn't, couldn't look after myself anymore. Yeah, but I think that's really interesting that you said that, because that's some of the confusion that the people who are experiencing post-COVID syndrome, the scans that they're getting are showing that their lungs are fine. There's a lot of confusion, and I just think that maybe the wrong scans are being done to pick up the damage.
Is it a CT scan or is it an X-ray that they're doing? Do you know?
Different people would be. So I had an X-ray on my lungs. I didn't have a CT scan on my lungs.
And each country is very different. Like Australia, maybe it's different. When I talk to my friends in India, like the doctor friends, apparently they are doing a lot more CAT scans. They find that the CAT scans are much more reliable. Even like the testing is not reliable. They'll do the CAT scan. If the CAT scan is showing damage, they'll go and treat them as COVID.
Yeah. Okay. And so what about the heart scans?
That makes sense to you.
Have you had scans on the heart? Do you know much about what damage is being found in the heart?
On the heart? Yeah. We had some patients where the lining of the heart on the inside, it is inflamed. So they're having chest pain, they may have shortness of breath, and they're also having increased risk of blood clots forming inside the vascular system.
Would that be contributing to the stroke-like symptoms that people are experiencing?
It is possible, but we think the stroke is more because of clotting happening in the vessel supply in the brain.
Right.
Sometimes the clots can travel from the heart to the brain, but we think it's more the vasculature in the brain itself, which is inflamed and probably at risk for clotting.
Wow, that's actually terrifying.
Yeah.
That is
really,
really terrifying. Because with me, there's the brain issue still going on, but that my worst symptoms was stroke-like symptoms, and
more in the brain. Okay.
Yeah, and when I did go to emergency, I was diagnosed with viral myocardosis. So
myocarditis as well. Okay.
Yeah. So is that the inflammation of the lining?
Lining of the heart. Yeah.
Yes. Okay. Well, that makes sense.
Were you having chest pain at the time?
Oh, yeah. That's so I had numbness all the way down, and I like droopiness here. And I was on steroids for a week, and then they stopped working, and I finally went because I was trying to stay out of hospital because I was going to leave my kids alone.
Right.
And but they were also watching me having what they thought was a stroke. So I decided, I'm not doing this to them again, and I'm going in. And I had all manner of pain in my heart, like stabbing, like it felt like my heart was getting squeezed, radiating pain, going down, Yeah. And the constant chest pain down the center, that was through the whole sickness, that was always there as well.
Yeah, and unfortunately, I don't think the steroids really help. And they may help to some extent, but we really don't have a good treatment, at least in traditional medicine.
Yeah.
For the myocarditis,
Yeah, no, but the steroids help with the droopiness.
Okay.
And the tingling and the numbness, and they really help with that. But then my doctor doesn't, didn't want me being on them for any length of time. I probably would have still taken them for longer, but he was like, no.
Like, how long in total did you take the steroids for?
4 or 5 days.
4 to 5 days. Okay.
Yeah, and it was
I've seen some doctors doing 10 days. I've even seen some doctors do for like as long as 20 days here.
Yeah, my doctor's very cautious on
Okay.
Which is why I like him. He's not a medicine pusher. He's more, let's see what we can do, and
that's good.
Yeah, he's great.
Yeah.
So how do you approach supporting COVID patients?
So I follow Institute of Functional Medicine. It's I probably met you on their group, or probably you were on their group. Okay, so they have a protocol where they combine dose of vitamin C, vitamin D, zinc, which are the main ones, but they have other supplements as well on their list for either treatment of COVID or for prevention of COVID. Something like echinacea and so forth. And I usually follow that. I sometimes do high dose vitamin C infusion. There are limited research out of China which showed that when you do high dose vitamin C infusion, it can help reduce the length of stay in the ICU. It can make people go from the ICU and then make them feel better, and they go to the regular hospital, and sometimes they even go home early.
Yeah.
So I've done that, and then I've also done energy healing for some of my clients.
So how does the energy healing work?
So the energy healing is something like acupuncture, but I don't use needles. I work with my hands, and I work from a distance, remove any blocks in the chakras, and work on the aura.
Yeah.
So I've noticed that the COVID, it can not only affect the lungs, it affects the entire body. Then I'm talking energetically, not sometimes physically you may notice, but energetically it affects the entire body. So you have to work on all the chakras.
Yeah.
And make the body strong enough where the immunity can fight off the virus.
Yeah. And I think for people who have been sick for a long time, just that, that makes sense emotionally. It's the emotional toll is what is the hardest, I think, for a lot of people. So
it's very difficult. And also, the difficult part is you cannot talk to anybody.
Yeah.
You cannot ring your general practitioner. You cannot ring your nurse, and like there is no point in talking to them because they'll say, just deal with it.
Yeah.
So there's nobody to talk to. Like they don't have, they can only talk to their family, who may or may not be able to help them.
Yeah.
And they develop depression after a while, and it's very difficult.
Yes.
And then the society judges them for having an infection.
Mm-hmm.
It's like if you remember, do you remember leprosy in India?
Mm-hmm.
Leprosy is they have contractures in hands, and those people are looked down upon.
Yeah.
Like a long time ago. So the same thing happened with COVID. People are looked down upon, and nobody wants to talk to them. Nobody wants to be social with them, and all of this contributes to an emotional toll.
Yes.
Yeah.
Which is why these groups are so wonderful. And those of us who got sick early didn't have that support,
That's true. Yeah.
But what I'm noticing, the people who have the support in their families are the ones that are doing better. They're healing, they're stronger, they've got more hope. The ones whose families are not supporting them, their friends, there's a huge element of thought that it's just anxiety or that you're making it up, and especially people who weren't able to get a positive test.
That is true.
And there's a whole heap of us who the testing wasn't even available because we were sick too early. And by the time I got tested, I was well outside the testing range.
That is true. Yeah.
And so it's the emotional toll. What people don't realize, and there's a lot of people who are suicidal. Every day somebody will say, I would rather be dead than be going through this again.
Because remember, at least in the West, in Australia, Europe, and America, people are used to going around, and they're used to going to the restaurants on a regular basis. They're used to going to the shopping malls. They're used to going to movie theaters, like everything that a normal person does. And then suddenly, over a period of 6 months or 10 months now, you're not letting them go anywhere. So that itself will make you depressed.
Yeah. That's why this has been so fun. I mean, we're opened up now. Things are pretty much back to normal here. We're still wearing masks, but there's restrictions on social things. But we were in lockdown for a very long time.
Yeah,
harsh lockdown. But so I think it's a lot easier here than I think other parts of the world. But having these conversations is actually really uplifting.
Yeah, no, Australia. Yeah, Australia is in a very unique situation because they're landlocked. They're separated from the rest of the world. I think they have a really good opportunity to control the virus because they can absolutely control international travel. So
Yeah, and we're also a smaller population, and we also have a mentality of it's very strict getting into the country for a number of reasons, and my home state, Western Australia, is even more isolated and more, the mentality of anything getting in there. You can't even bring fruits or food, a lot of things you can't bring into the state. So they locked down really early, shut off, and they've been, they've had it controlled within a couple of months.
That's good. Yeah.
Yeah, it is good. But we have a geographical advantage.
Yeah. Cool.
So is there anything you've found that is really helping the COVID patients the most?
That's a really good question. So some of my patients have tried glutathione using nebulizer.
Yeah.
Obviously, you can take N-acetylcysteine, which can help with increasing glutathione. Like anything that helps with antioxidants that helps COVID. So we have used N-acetylcysteine. The brand name here is Mucomist nebulizer. That has helped some of the clients. We regularly use that for kids with cystic fibrosis who have really bad lung disease.
That makes sense. Yes.
So we have used Mucomist. That helps. We have sometimes actually used the glutathione into the nebulizer, and that helps reduce the inflammation in the lung. And mainly vitamin C. I would suggest using high dose vitamin C because it's very safe, it's easily available, and it really helps with the immune system.
Yeah.
Yeah. So that's on the holistic side. Traditional medicine, like what I have done in the hospital is, for most of the clients, we're giving the dexamethasone, which is a steroid. So most of them get that, and then we are using remdesivir as long as they qualify for the drug.
There's been a bit of talk about that in the forum. Now, what is that normally used for?
It's an antiviral drug, and it's something similar to what we use for HIV.
Okay.
So it's an antiviral drug. So we give it's a series of infusions over 5 days. So most of the patients are getting that. And the last thing that they're getting that really is helping them is we call it convalescent plasma, where let's say you recover from COVID, we take blood from you, take the antibodies, and we inject into the patient who is sick right now. So I think that's really helping a lot of patients.
Yeah, I know that's not available in Australia.
Oh, really? Okay.
No. It's interesting the way that they've approached it here. We don't do antibody testing. can't
oh, really? Okay.
Yeah. Which raises questions. Why?
Yeah.
Why?
I think antibody testing is important as well, because sometimes you want to look back and see if you have IgM or IgG antibodies.
Yeah, and know how. Are you going to catch it again? That's I would love to be part of the research for that, but and all my children, because they all got sick to varying degrees. I think my son, who hardly got sick at all, he's probably got great antibodies in his system.
That's probably true. Yeah. Yeah.
He could easily donate if they were doing that, but yes.
Yeah.
So, as I've mentioned, the neurological symptoms are, seem to be the ongoing complaint for those of us who've gotten over the main symptoms. Apart from there is random throwbacks, which is just part of the unexpected, I think. So is that something that you're seeing in patients, or?
Yeah, a lot. So I recently got a call from somebody, this particular client or patient. She recovered from coronavirus. She really didn't have a major illness. She just lost smell and maybe taste. And then she recovered that in a week. But her main thing is she has this burning sensation in the arm and the leg. Like, we call it neuropathy in traditional medicine. And she reached out to me saying that, hey, this is not going away, and I really don't want to go to a neurologist or a gastroenterologist, because they're going to prescribe regular medication, which may or may not help. So neuropathy is becoming very common. There's a lot of brain fog, if you know what brain fog is.
Yes, I call it Rona brain. But yeah.
Rona brain, yeah. I didn't know that there's a term.
It's for me, because I've had a lot of brain fog over the years, just with different illnesses, and for me, it's slightly different. There's an emptiness rather than a fogginess. There's a fogginess too, but literally there can be nothing, nothing going on in my head.
Yeah, we can probably do like a neurocognitive test and show you like which domains your brain is not performing well compared to before. So we are seeing a lot of that, and I had few patients who had COVID, and then they suddenly developed a massive stroke where we had to fly them to a different hospital.
Yeah, wow.
That happens. And I was also studying research, before I got on the call with you. There's some Canadian study which is they're looking at accelerated aging in the brain, where if you look at a brain of a 90-year-old and compared to a brain of a young person, the 90-year-old brain has like a lot of mini strokes. We call them like Lackner infarcts. And they're saying that maybe COVID is causing that, where it is accelerating the aging and causing these mini strokes in the brain.
Wow, that's. I said to my son, this actually made me tear. I said to my son last week that if I can't figure this out, I feel like I'm going to have dementia in a few years.
That is true.
And
yeah,
that's what it
and
feels
they
like.
talked about it, like if this is not treated, and COVID in the long term can lead to dementia. That's what they are. Again, this is preliminary. They're thinking about it, and they're doing research now. And it's really important that, I'm not trying to, when I do these calls or interviews, people think that I'm trying to scare people because I'm a doctor and all of that stuff.
I don't think that.
The reason why we share this knowledge is because we still want people to be careful and work on their immune system so that they don't have to deal with it. You got the infection, so now you're dealing with the consequences. It's much harder to reverse the damage rather than not have the infection in the first place itself.
Yes.
As we go normal lifestyles where things open up, people will obviously, they'll start eating sugar. They'll go back to their old lifestyle, which can, like drinking alcohol. All of these things can screw up the immunity. And once the immunity is screwed up, even if it is screwed up for a few minutes or a few hours, that interval is enough for the virus to get in.
Yeah. And once it's in, it does whatever it feels like doing.
Even having fear, even having fear for a little bit of time can screw up your immunity, and you're creating a passage for the virus to get in.
Yes, that's a hard one. And I think as when you are going through the extreme symptoms, there's fear there. And I'm very aware of the avoiding the stress. I was meditating an awful lot, but this is the sheer reality of what was going on, and not knowing how bad it was going to get. It was very hard
especially with brain fog. We notice this in a lot of TBI, we call it traumatic brain injury patients. They only have a few hours in a day where they're completely alert, and they have to do all of their work in that particular time. And that itself causes stress.
Yeah. And there's for me, it's just come to the acceptance of I can only do what I can do. And I've accepted that the rest is part of my work. And sometimes that's sleep, sometimes that's watching a show, sometimes it's just sitting outside. And doing literally if I just do a little bit of a little bit of a little bit, everything's chaos, but that it gives me a sense of satisfaction, which in itself is helping me. And
one of the things, I don't know if you have hyperbaric oxygen there therapy. And
I'm looking into it. Devin, that I interviewed last week, he has been doing that and has said it's helped him a lot.
It has helped. I haven't referred anybody for that, but that's something I would recommend to anybody who has like brain issues. We use a lot of hyperbaric oxygen for people with chronic Epstein-Barr virus, people with traumatic brain injury. It really, the brain, brain recovery. We're also looking at other technologies. There's some other, there's a device called NanoVi, NANOVI. And apparently this particular device, when you use it, it improves your immunity. So I never used it, but there are some centers here in Florida that, but again, we need more research, especially in these clients who have long-term COVID complications, to see how they can feel better.
Yeah, well, if you ever need to find a research pool, I can help with that.
Sure.
There's, people looking for answers and would more than happy being part of stuff. So if there's ever any noise going on for research participants, they're easy to find.
Sure. Yeah. And I personally, in my practice, I do a lot of energy healing. So, that in addition to everything else, I do that for people who have long-term COVID.
Yeah, the type of osteopathy that I use, or the osteopaths that I see, they work on a very energetic level. There's no, push and shove. It's all energy healing. And after treatment, there's such a difference in me.
You notice that? Okay. That's really cool.
Yeah. But when I was really sick, I wasn't able to get that.
That is true. Yeah.
I couldn't.
You don't have access. Yeah.
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 But, I don't think that I probably could have even gone through it. So before, when I was talking about trends, have you seen sort of trends in the way that symptoms present in the early stages?
So we have been focusing a lot on lung, like cough, shortness of breath, and mostly fever and body aches. But one of my best performing videos on YouTube is about diarrhea. If
Yes.
you,
I
because a
had
lot
that
of people
for 3
have
weeks.
a lot of people have diarrhea, and CDC somehow they never accepted that
Mm.
fact for many, many months.
They
Only in the
didn't.
last 2 months, that CDC as on their website they put diarrhea as a symptom.
Mhm.
And it's very disabling because
Mm.
you can't go to the doctor, and if you go to the doctor, all of the tests come back normal. And the only way to get rid of the diarrhea is by getting rid of the virus. And it's the same dynamic. If the virus is chronically setting in the system, you'll continue to have bouts of diarrhea over months and months.
Mhm.
And I learned all of this by from the YouTube video, because I had a lot of comments from people who actually had those symptoms.
Yeah.
I still see people who have acute COVID who have lung symptoms, but they also have diarrhea. So,
Thing. See,
but the
my
long term,
sorry.
but the long term stuff, that I learned from comments from the videos that
Mhm.
I posted.
I should share some of your videos in in the group chat. I'm a part.
Sure, yeah.
Yeah, so if I mine was only 3 weeks, but that's my area is gut health. That's what my area speciality, and so obviously what I did eventually worked. It threw me that I couldn't get on top of that it was 3 weeks it took me to actually get on top of it. Obviously it helped somehow. So
Yeah.
It made me lose a lot of weight. I called it the Rona diet. The Rona diet.
But sometimes if you have viral diarrhea, then you may be losing muscle mass. It may not be completely fat.
Yeah, no. It was.
Yeah.
But still. So are there any we've already gone through sort of tips for those of us suffering Rona brain, but is there anything else you'd like to add to that?
Yeah, I would work with a practitioner who is comfortable dealing with COVID and who knows and understands like long-term consequences of COVID. Because a lot of doctors, they're busy, they may not be interested in treating people with COVID. And also, if they're completely traditional medicine oriented, they'll only treat with, I told you, like the remdesivir and some of the medications, but they may not offer anything afterwards. So, I follow the Institute of Functional Medicine guidance, like the vitamins and the minerals. I would use the nebulizer, sometimes use mucomist nebulizer. And as I told you, now I'm open to exploring hyperbaric oxygen therapy and all the new technologies. These were there before, but we never used them in COVID patients.
Yeah.
So I would entertain those, and I would really, if I were in a situation where some of your audience are, where they're not getting good guidance from their doctor, I would look for somebody who's well trained in this area who can help them along.
Yes, I think that's what people are struggling with, finding those people, which is why I've put a few doctors that are treating long-term patients on my website. But I know, and you would know just from the functional medicine forum, there are so many doctors out there who were on the ball earlier. And for me, I found it really exciting to see all the modalities being shared, and there are, it's just finding those people, and I guess they're so busy.
Yeah, that is true. Yeah.
So I just answered my next question. So, but do you think that this pandemic has brought the best of the healthcare world, the great minds together?
I think it is, like the speed with which they're coming up with the vaccine, the speed with which they're coming with different treatments. I think healthcare is shifting. Healthcare is very, I don't know how it is in Australia, but it's very arcane. Like change takes like sometimes years, decades. Change is very slow, and this is pushing healthcare where they have to change, otherwise they have to shut down. We lost so much money. I'm saying we, but it's my is the corporation that I work for. They lost millions and millions of dollars when everything shut down here. So they had to adapt and change. They had to bring new therapies. Same thing with the scientists. They're having to do so much research in a short period of time. It's mind blowing. I'm surprised that they have so much research out already in the last 2 months.
And even within the first few months, that's how I learned a lot of what was going on, was just from those early research that was going on in March and April. You know, I mean, that they knew then the heart symptoms, and you know that
is true.
Heart, you know,
Yeah.
You know how at that stage, but they knew. Yeah. And for me, that was a great peace of mind. And I think having access to the information that I did made the journey easier. I kind of knew where it was headed, kind of. And I have a cousin who's a doctor, emergency doctor, and she was a great support for me because she had, you know, her medical information coming through, and she could say, okay, you're at this stage. This is where it could go wrong. So be careful for this, watch out for this. You know, if it gets to this point, this is when you need to go to hospital. And it was, you know, she was a great support. It was wonderful.
That's good. Yeah.
I'm very lucky, very, very lucky.
Yeah. Yeah.
So is there anything else you would like to add?
Yeah, I'm really excited about sharing all of these things with you and with your audience. I want to share as much as possible because people need this information, and people need the support, both not only emotional, but from me being a practitioner, I'm always here to help people. So and this is a great way to teach people because I can do one-on-one, but it's only one-on-one, and it doesn't translate to thousands of people. So yeah.
Yes. So I will, when this goes to all the places, I'll have a link to where people can find you. I know I've got one on my website, which I can't remember the actual.
Oh, that's okay. I'll share my website link, and then my phone number, my email. I'll send it to you.
Yeah, fantastic. Because I think there will be a lot of people interested in talking to you, and it's refreshing to you're in the mainstream medicine, but you're in the integrative, and you're using a lot of modalities, and it's just really refreshing and reassuring for me. You've told me things today that make sense, okay, that I haven't found out elsewhere. So I really appreciate your input. I'm sure people are going to find a lot of insights in here that they're not crazy.
I know.
They are going through this, because there are those people who are calling us crazy. And there are those moments where you doubt yourself, like, because it's so unpredictable.
That is true.
And it's what I'm noticing in talking to people is the symptom progression is random for people. It's so different. So are we imagining these symptoms? Is this really happening?
Yeah.
So
it's very difficult, and also the information is not it's not free flowing. Like the Google, I don't know their trends. I don't know how they set up their filters.
I think they've been quite restrictive in a lot of
So the information is not free flowing like 10 years ago, and that's a problem as well.
Yes. Yeah. Absolutely. Yeah. Well, thank you very much, Dr. K. It's been wonderful.
Thank you very much, Ivy. Thanks for this opportunity to chat with you and with your audience. I really appreciate this. Okay?
I appreciate it too. Thank you.